to begin with. I'm not sure if this is valid, but yeah, I guess. Yeah. So let's say if I'm a scientist and if I'm not creative at all, how do I even recognize creativity when I'm? Yeah. So I guess that's my question.
Some of the pitfalls of the creativity study
Self. This is some of the pitfalls of the creativity studies itself. That is why we very carefully chose artists alone, not the scientists. Now, if you look at even an artist, a musician may not be very well versed in the visual art. So what we want, and the tests are very standardized tests. So probably in future what we need to do is take a group of people, which for example if it is musicians, maybe we'll have to in the scanner itself give some musical, piece of music to see which are the areas that is being implicated. So segment wise I think the research should go on. Now as of now, as a beginning, what we did was we took various people from different fields.
No, I meant the scientists who study creativity. Let's say if I'm not creative enough to
Okay, you mean to say I am not creative?
No, I'm not saying you're not creative.
No, right, I understood. Yes. Probably yes, I think you need to understand the nuances of creativity. Well, I am creative by myself because I do a lot of visual art. So, and I think the student who's also done this creativity study is also a good writer.
Okay.
So, I think you need to have the nuances of creativity to carry out the news.
And a quick question to Dr. Kruger is, you talked about the oxytocin study. I'm sorry, I'm a lay person, so I didn't really understand the intricacies of it. However, you said that the people who have oxytocin, it was seen that they could empathize with people more. Is that what you said? So can it be said that people who have empathy in general, both men and women, I mean, obviously men cannot have it, but
Thank you.
Do they have it? I don't know. I'm not a scientist, but do they have oxytocin at a high level naturally? I mean, let's say I'm an empathetic person by birth.
Yeah,
so
there are
is
studies.
Is it that I have more oxytocin
There
in
are
me?
studies. They have more oxytocin and plasma, and also you can have different gene types. So you have here a lesion in a SNP, a specific oxytocin receptor gene. We have to study also to behave more pro-social.
Okay.
But also, the selling point from this study is actually you can make people temporarily much more empathic, and then you can put a training on that. For example, people who have problems to be empathic, borderline psychopaths, you can make them temporary with oxytocin doses, empathic, and then you have a cognitive behavior training program to make a training. So my message is not buy oxytocin everybody and take it, right? That wouldn't, but to use it as a tool, as a training tool.
Okay. Thank you very much.
My name is Girisha. My question is to Madam Bindu. Thank you, Madam, for insightful presentation on how the meditation has impacted on the sleep patterns and so on. Was there any research done from your side on the mystical experiences also? I mean, extending the same question again, is it possible at all to identify unambiguous neural correlates which can identify mystical experiences?
I mean, in our study we haven't looked at that aspect, the mystical experience and the neural correlates. I don't know. Maybe, I mean, I haven't come across also any
I can tell you.
studies. Yeah.
So actually, we published recently a paper, a lesion paper with our Vietnam veterans. If you have a lesion in temporal lobe, they report more, for example, a mystic experience. So you have a questionnaire, and then you can compare people who have a lesion there. So that's on just when you have a lesion specific areas. And I can give you later the resources for that one.
Yes, I have brief questions to three speakers. First one is to Professor Bindu. I was a little surprised that in the meditation group, the REM sleep increased, and that was kind of surprising. I would have expected that the meditation group would have less anxiety, less nightmares, and less of the REM. I can understand that the non-REM increase and the REM should decrease, so there is a sort of balancing effect. So if you could respond to that. Then the question to Dr. Ganesh.
Can I respond to the question?
Yeah, go ahead.
Yeah, see, there is a notion that meditators don't need that much of sleep. See, for example, we need to have 7 to 8 hours of good night sleep to carry out our, daily daytime function. So any normal adult human being, we need more, almost 7 to 8 hours. So there is a notion that following meditation, you need to have that much of quantity of sleep. But in our study, what we have observed is the total sleep duration is almost same, whether it is a control group or a novice or even the advanced practitioners. So that itself, gave us a lot of surprise. Okay, meditators also do require the normal quota of sleep, that is around 7 to 8 hours of sleep. That is one thing. Second, as you said, like we have observed both enhanced the slowest sleep state as well as REM sleep state. And the REM sleep state in a normal person, for example 7 to 8 hours of sleep if you take, REM sleep occupies almost 20 to 25% of the total sleep time. So that is the usual quota. So here now we have observed an enhanced REM sleep state almost 30 to 32% when compared to the 20 to 25% of the normal. So there could be, from functional point, aspect, if you look at REM sleep has got a lot of function to carry out. See, for example, if you look at cognitive functions, memory, consolidation, all these memory, especially memory consolidation takes place during both an REM sleep as well as the REM sleep. But REM sleep, the synaptic, various brain plasticity is occurring, events are occurring. Thus, it enhances the synaptic consolidation of memory. So, that is one point we can think of. Like enhanced cognitive functions could be due to, the REM sleep. That is one thing. And REM sleep, now since we have observed that there is enhanced REM sleep, it's a very fertile, area for us to understand various aspects of sleep. For example, he has mentioned about the mystical experience. You can study a lot about the physiology of dream, and physiology of even the lucid dreaming, lucidity of the dreaming, that is you are experiencing the dreaming. So that there are reports say that meditation enhances lucidity of dreaming. So we consider this as an opportunity to study, these aspects in meditators. Otherwise, enhanced REM sleep also is considered as is an index of sleep satiety. Already it is satiated. So it is a period in between the deeper sleep state and the wake. So, you can easily also enter into a wake state. So there are ample, opportunities for us to study various aspects of sleep by studying meditators' sleep, especially the REM sleep.
My question to Dr. Ganesh is that the four virtues of Mudita, Maitri, Karuna and Upeksha are emphasized both in Patanjali's Yoga Sutra as well as in Buddhist tradition. You interpreted Upeksha as indifference to the world and worldly life. And but I think another way to look at Upeksha is not only that, but to be able to ignore the past and the future. So indifference to the time, that gives you freedom from the past and the future, and you stay focused in the present. You're open and receptive to the present. I'm a poet. I published 4 or 5 books of poetry. And for me, it is important to forget the last poem before I come up with a new idea and a new poem. So that's an important skill. So we need to interpret Upeksha as both freedom from space as well as freedom from time. That's important.
Very well said. What I meant is the same thing, because world, according to Vedantins, I identify myself as a Brahmavadin, where world is nothing but the product of space and time. Desha and Kala, they are the products of avidya according to Vedanta. And world is nothing but product of space and time. And all this causation is product of space and time. Because of causation we have the world. So upeksha to world means inclusive of both space and time. With that intention only I told, and you have wonderfully clarified it for the benefit of others as well. Thank you.
And my last question is to Dr. Rajan. I have published a paper called Cognitive Pause and Unload Hypothesis of Creativity and Meditation. And as you mentioned, the 4 stages: preparation, incubation. So the ability to pause is just as important as the ability to create and do something. In fact, one of the difficulties that most of us have is to be able to pause. We have to learn to pause, to smell the rose, to look at it, and then to write a poem about it or take a picture or paint or whatever. So do you have any measure of ability to pause an ongoing activity, which is inhibitory of course, which is very important in the process of creating?
Well, in the behavioral study, we did give these pauses for the for the person because the time was not a constraint. But when it comes to the imaging, you cannot keep the person more than 40 minutes inside the scanner. So what we are right now doing is correlating those results with the behavioral study to see if there is any correlation between these two, behavioral as well as the imaging studies. Yes, I do agree that pause is very, very important, and that is the stage of illumination.
Yes.
Because it can go on from days to years.
Yes. Thank you.
It's a question to the whole panel actually. We had the discussion on creativity and meditative practice, neuroeconomics from the neuroscience perspective. Let's take a different perspective. Recently I was going through the literature of artificial intelligence, and 2 examples I am giving. Ray Kurzweil, the author of Spiritual Machine, has developed a software program known as Cybernetic Poet, which analyzes the language module and can create poetry. David Cohen at University of California has developed a program, Aaron, which can draw painting on its own. My question and to the panel, even artificial intelligence people are saying computers can have religious experience. The question is, if you have a computer and the computer looks like a human being, and if he, she, it can draw, can write poetry and claim to have mystical experience, are you ready to confer consciousness and creativity to that computer program? Thank you.
Irrespective of the person or machine or whatsoever, whosoever has produced an art piece, if it meets the qualifications of an emotive art piece, then it's over. We don't bother from where that has come, but what the product is.
Thank you.
So from the viewpoint of aestheticians, Indian aestheticians, we don't have any problem at all. And even that thing is engineered, and that machine or whatever, that has been furnished with the human brain, is it not? That's why directly or indirectly the emotional world has involved. Unless the human emotions change, Indian aesthetics will not change.
Yeah, I also confer with this particular aspect, because I think if the machine is able to give us that kind of understanding and that kind of emotion that brings about, I think the whole concept of is, we can confer saying that it's no different from a person drawing it and the machine drawing it.
Thank you.
Taposh Datta. Well, just to the context of the last, I was a architect and designer of microprocessors, which are computers on a chip, for the last 25 years. And my opinion of, after designing computers, many different types of computers, is they are the dumbest things that we have created. They have absolutely no intelligence on their own. My question to Srimati Kutti is that twofold. One is that in trying to measure brain activities, have you used alternate practices that people follow? For example, people do 1 lakh japa or name of God, or they continuously sing devotional songs in temples. Now, once that has been done for many years, like the many years of meditation, can that be studied, or have you seen such studies?
Yeah, at NIMHANS, not with my group, my colleagues, they are involved in this kind of studies, especially japas, the Gayatri mantra, and looking at the brainwave changes, and even looking at the MRI, the brain structure changes. So there are studies, even the music, how the musical notes, how they can influence, how they can enhance your, well-being. So these kind of studies are going on in the institute.
Okay,
one
can know more.
Yes.
And the second question is that there are apparently neuronal cells in the heart, in the stomach, and so on. Now, are parallel studies done of those to see what effect the rest of the body has?
Yeah, definitely. For example, I have just mentioned about the autonomic nervous system. So the whole internal organs, our lungs, our heart, our intestine, everything each one has got a dual innervation from this autonomic nervous system. So we have the sympathetic system as well as the parasympathetic system. For example, you take heart. Sympathetic system activate the heart, heart rate, blood pressure, and so on, contraction, contraction of the cardiac muscle. Whereas parasympathetic is to relax all this, So there should be a balance between sympathetic and parasympathetic. So we call it a sympathovagal balance. And if sympathovagal balance is very important to have, I told you about the brain integration. Even for the brain integration, you should have all this balance. So if this balance is altered, especially yours, it is usually altered towards sympathetic. So if there is a sympathetic predominance, lot of, you can even see cardiac dysfunctions. From cardiac dysfunction till neurodegeneration, we can look into these aspects and study. So these are also important to have a proper body-mind harmony and to have a normal, functioning of the system.
Myself, Anil Kumar. I have a question for Professor Frank. Do you think hurting or harming others is a natural phenomenon? And related with it, does it always involve a certain level of self-consciousness? Hurting others or harming others is a natural phenomenon for human beings.
Yeah,
and does it involve always a certain level of self-consciousness?
I'm cautious with the word consciousness. I'm talking about, I think this is hardwired in our brain that we can empathize in it, other gets hurt, and we know already what brain is. So there are the mirror neurons, etc. So when I see that something happened to you, one theory explains the simulation theory, I do the same thing happens in me, and automatically I understand it. And that's on the lower level. That would be, I don't know if I can say this is conscious, but this is automatically, but for example, you also have to understand the mental states of the person. There's other areas involved. There you need more the prefrontal cortex. You have to put yourself in the shoes of the other ones. But I think every normal developed brain has the capacity, and we see it that in some brain or some brain disorders, it doesn't work. And that's why they have, for example, problems to understand others. They know verbally the rule, don't hurt, but they don't feel it. And we know both. We know the rule and we also feel it. And that's the difference.
That's about punishment, but harming itself, what does it involve when we think about harming others? Is it something which is happening naturally to me? Why do we need to harm others? It's something like, the other species, they do it, on purpose, they have certain...
Yeah, they do second-party punishment. The monkeys or etc., there's experiments, if you take food away, they hurt the other person, the other ape, right? But what I'm arguing is there are specific other brain areas needed to do third-party punishment, and we as a human species, in our evolution had to come up to solve that problem. That's why I developed bigger, larger prefrontal cortex, so we can more deciding, more taking the emotion out, etc. But I don't know if I get the first one, but hurting, I see that on the facial expression, I can see that somebody get hurt, right? So if you do the same, internally my mirror neurons lighting up and doing the same thing, and that's why I know that you got hurt. So basically on facial expression, etc., I can see that somebody got hurt. It's not theoretically, I see it physically, somebody got punched, or somebody's doing a specific face expression and a body expression. In there's experiments, if you take them apart, right, you do a face expression but a different body expression, people got confused because they're so hardwired that both go together. I don't know if that answers your question. Yeah.
My question is connected to this. Do we have a primordial urge for violence? Is there any evidence in the brain? Because violence is so much. It was connected to that, that's why I asked.
Yeah, sure. We also can be aggressive if needed. Why does it? We can both. There's also an urge to survive. I mean, if our survival depends on, in-group, out-group, right? 30,000 years ago, there was protection of in-group, out-group, and there's violence going on. You have to be also aggressive, but that's different brain areas. And normally those are, you can control them, and that's why we have also prefrontal cortex. For example, if you have specific lesion in the prefrontal cortex, the ventromedial prefrontal cortex, people are more impulsive, more aggressive. So basically our brain is always on break. We have this, and we can also initiate it. I think shouldn't we have that also, or is that something, I think for me it's a survival tool. Yep.
Namaste, this is Sumantran Ray from IIT. My first question is to the neurophysiologists and neuropsychologists, particularly Professor Bindu Kutty madam. So, what are the different ways of building cognitive reserve, and also what are the ways of cortical tuning, and can these be effectively utilized to deal with common disorders like, let's say, anxiety and so on, to build resilience against depression and so on?
Yeah, very interesting question. Two aspects you have to keep in mind here. I have just mentioned only the cognitive reserve capacity of the brain, whereas there is another term called as the brain reserve capacity. So we have two advantages. One is the brain reserve and the other one is the cognitive reserve. So brain reserve is that differs from the normal is mainly in terms of quantity. For example, the number of cells, nerve cells and their connections will be more when compared to the normal. Whereas cognitive reserve capacity, you are able to develop it over a period of time through techniques like, for example, meditation. So both has their own advantages, and definitely these have definite implications in the management of various disorders, like, as you said, anxiety disorders, especially anxiety disorders. You can develop cognitive behavioral therapy program. Various rehabilitatory programs we will be able to develop to activate or to enhance the cognitive reserve capacities. Whereas brain reserve, for example, I can just give you an example. Like there are reports on Alzheimer disease. Some people who have the same equal pathology, Alzheimer pathology of the brain is equal degree, whereas they will not manifest it clinically. That can be due to even the increased brain reserve capacity. So we can tap these through various methods, like various rehabilitation programs.
Cortical tuning?
Cortical tuning also. See, for example, cognitive retraining programs, various appropriate brain games, I feel, or cognitive tasks, definitely you will be able to enhance these properties, and that can be implemented in therapy or management of disease.
Thank you.
I'm Sashi from JNCSR Bangalore. So my question is again to Bindu ma'am. So this is regarding binaural beats or the brainwave entrainment. So where we try to induce preferred frequencies or waves. They use this to take brain into certain state, like peaceful state or meditative state. So nowadays we have many beats like this out where they say it will work for lucid dreaming and astral projection as well. So what are your comments on this? It worked for me. So the lucid dreaming I tried. And
There are studies to induce. See, for example, you said lucid dreaming.
Yeah.
So you can induce these dreaming states by various methods. One is like activating the brain through, like inducing some pulses. So ultimately, you would enhance the brain activity and induce that kind of, for example, in sleep state.
And they use this also to go into deep sleep state and other.
Yeah, there are. See, for example, if you are, giving a kind of lullabies, for example, that is the frequency of these lullabies are equivalent to theta waves. So that can induce sleep. And once you are, you induce sleep, definitely you can enter into different stages of sleep. So there are various ways by which you can study this, mimic these stages and study the various aspects. For example, even lucid dreaming, there are many studies, through, just providing pulses, providing current stimulation, then activating the brain areas and studying.
So if all these are possible, then why so much pharmacology and all? So we can just go into sleep by using this. Also, what's the need of meditation and learning meditation? Because just listening to certain sounds can.
Correct. See, that depends upon. See, for example, when you are dealing with major depression, so that depends upon the treatment options for a particular disease condition. For example. I can give you two examples. One is a mild depression case and one is a major depressive studies. In a mild depression, we have got some studies, to show that just Sudarshana Kriya Yoga, it is a variant of pranayama. That itself is very enough, to recover from that mild dysthymia, we call it as. Whereas major depressive illness, you cannot get recovery, total recovery just by, through this technique. You may require very effective drugs there. So maybe adjuvant therapy. See, you can use meditation or yoga as an adjuvant therapy for the existing pharmaco treatments. So these can be applied in a different way,
Okay, so it's well known that artists, however big they are in the field and all of that, they undergo this period called an artist block. And I want to know why that happens and what is the science behind it, like the science of creativity and all of that. Why do people undergo an artist block? It's really frustrating because even I have gone through one, and you cannot create anything and you cannot write anything, paint anything, whatever. Why does that happen?
I think there are various reasons to it. Probably your own mental set at that point of time, or it is that you're not satisfied with what you've done and you want to improvise it, and then hence you put forward. Even I've gone through these phases. So what happens if I analyze myself? Probably the pressing need at that time was something else, not my painting. So I would just put it across. So there is no one particular reason. There are very many reasons to it, and hence you put it and say, okay, let me do it at a later point of time.
Okay. No,
and that's why that period of illumination, you see, it goes on for years sometimes.
Is there like a science behind it?
Not that I've come across anything.
Okay.
Probably there are, all the youngsters can look into each aspect of this and take up a research.
Thank you.
One word from the viewpoint of Indian aesthetics, though deliberate mentioning of such artist block and all is not mentioned, but a poet, scholar, aesthetician and philosopher of Kashmir and devout student of Abhinav Gupta is Kshemendra, a versatile genius. He in his Kavi Kanthavarna, that is a guide for poets, there he mentions 100 topics, 100 areas of skills and proficiencies which a poet is expected to have, there some of them are directly addressing to this problem, and accordingly we'll be knowing deviating to another art certainly removes certain amount of artistic blocks. If I am blocked in one aspect of creativity, for example, if I am poet and I am finding some hindrance in my versification, shift to some other art, some other course and some other interaction, then it will avoid. And also taking a break and vivikta janasevitvam, parvataranya darshanam, smashana abhiruchi, like that so many things he mentions, even going to the burial yard and then getting stimulated. We have something like one poison will be a remedy to another poison, like that. So many other aspects, such aspects are very well mentioned. Such practical things. Indian aesthetics like Ayurveda, which is very clinical, so is Indian aesthetics very practical. It is not aware of all these experimentations which the psychologists and psychiatrists conduct, but it will go by experience. And so the pathology may not be known, the laboratory picture may not be known to an Ayurveda practitioner, but he will be knowing the clinical diagnosis. Likewise, an Indian aesthetician will be knowing such things. By looking into such texts, you will be getting some or the other tidbits by virtue of which some deeper research can be conducted in that direction. Thank you.
Good afternoon. I am Shampurna Ghosh from Calcutta University. My question is to Dr. Kruger. I want you to, I want you to comment on the fact, don't you think third-party punishment is more of a societal task than a cognitive task? Because we all live in different strata of our society, and those strata implies rules and norms on us. So we tend to think in different way in all those stratas. And I think this question is now very much prevalent in India. So I would really want you to comment on that.
Yeah, but at the end there are people doing it, right? I mean, you learn the social norm about punishment through the society, but at the end it's encoded in your brain, and we give judges or juries the past, and everybody learned it. I don't see, what do you mean by society? I mean, at the end there are people. You are raised in a specific society under specific norms. There might be difference between different societies, and there's different punishment for different, but at the end, I agree with you, the culture shapes the beliefs, kind of norms, but those are encoded in the brain, and I would argue these are the same brain areas. It doesn't matter what culture you are in.
Yeah, but I do something in my society and it will be regarded as a punishment.
Yeah.
And same thing, if it is done in your society, it might not be regarded as a guilt at all. So there's this difference. And I think it's in our social norms and culture and not in the cognition.
No, at the end it has to be in the brain somewhere coded.
Yeah, that's
I mean, I learn it. Why? I got raised in Germany. I get a different culture, beliefs, and then I go to the U.S. For example, Germany is against death penalty, right? In the U.S., this is an option. They think this is the most part of punishment, what you can do, but it doesn't work. So I think the culture shapes different norms, but at the end, those norms get stored in everybody's brain, and those are the same brain areas. But my insula doesn't light up in this society because I think it's not a norm violation. Yeah? Okay.
Thank you.
Sure.
Good morning. I am Binsi Matthew, research scholar from MS University. I have a clarification, just it's not a question, to Dr. Bindu regarding the meditation. You have mentioned that the higher mental abilities, the functions of the mental cognitive abilities enhances the meditation, the vipassana. Have you come across in your studies, or can you tell us in particular the cognitive abilities of the higher order? What are the abilities regarding memory, problem solving, such as you have found any difference in these novices as well as in the senior meditators?
In general, meditative practices enhance the cognitive functions. And we have various ways to analyze the cognitive functions. Neurophysiologically, we measure certain wave patterns, and we can, analyze. Initially, we have observed. There are sometime, you may not see much differences in the amplitude. See, many of the studies have showed, but it is not our study, we didn't see much differences. But otherwise, many studies have shown that meditation proficiency enhance cognitive functions. Okay, so there are clear-cut differences between the novices as well as the, the seniors.
Has it enhanced the behavior pattern too?
Definitely, it molds. That is what I said about, we consider that as a mental attribute, higher mental. So definitely you are developing, evolving in your mental efficiencies. So definitely this meditation enhance, especially the long-term meditative practices, help in the total transformation actually.
Okay, thank you so much.
Last but not the least, I am Krishna Swami, an independent researcher regarding the Neutrino Observatory which is coming up in Tamil Nadu, Thene district. I have a question for each one of the panelists, if time permitting and hunger permitting. The first one is to Professor Kruger. How does food impact punishment tendencies, sir? How does food we take in impact punishment tendencies?
Yeah. Are you referring to a special published paper? I think they did it with judges. They had breakfast and they behaved differently after breakfast. Yeah. And I would have also have given a different talk after lunch because I'm very hungry now. No, just kidding. But no. Are you referring to this study or? No, but there was actually a study. You know, sometimes scientists have a lot of time to think about it. Fancy studies. They did this. They asked judges. Yeah. Does it answer? Yeah.
It answers me. Number two, this is for Shatavadani Ganesh Ji. Way back I will leave you all within 2-3 minutes, sorry. I had the opportunity in 1979 when I was in my teens, a program done by a 72-year-old Ashtavadani Ramaya Pillai in Tamil Nadu. And he was
a blind man, is it?
Yeah, blind man, that's the point. And he was able to tell the name of the Pakistani cricket captain Asif Iqbal, then captain Asif Iqbal, in a reverse manner. That was astounding, especially for a person who couldn't even pronounce Asif Iqbal, but he was able to do that because of his faculties. My question is to Ganeshji, the trauma victims, dementia patients, Parkinson's syndrome patients, do they lose their faculties? The multitasking and wearing many hats faculties.
This question should have been answered by the other people of the panel because it is not directly connected with my topic. I honestly feel multitasking is working at two levels. One will be taken seriously and the other will be in hibernation. That will be going on. Whether it is Ashtavadhanam and Shatavadhanam or Sahasravadhanam, the number is big. But it will be a sequential one, but will be switching over very fast. That's all. That's what my experience says. Two things cannot occupy the same place at the same time. So one will be in preference and other will come immediately afterwards. That's how the process of Avadhana, the art of Avadhana goes on. And you told about Ramaya Pillai's reverse way of telling. I add one thing from Andhra Pradesh. Madabhushi Venkatacharya, he not just repeating the names in the reverse order. First ever hearing any verse for the first time hearing, he used to reproduce it directly as it is. And then second time he used to recite the whole verse in the reverse order.
Oh, great. In Telugu.
Yes. Madabhushi Venkatacharya of 19th century and early 20th century.
That's great to hear.
I'll just answer this question. Yes, they do lose their cognitive abilities, especially the dementia. It is known a degenerative disorder, Parkinson's patient, Alzheimer's. They do lose their faculties slowly over a period of time.
Very sorry to hear. This to Madam Bindu, this regarding the comparative aspects of various meditative tools or various meditative systems. Like
Vipassana she had been elaborating on. I had the opportunity 20 years back to undergo a Vipassana 10-day course. From what I understand, the sensation watching, observing the sensations is of prime importance in Vipassana. And something like Sri Sri Ravi Shankar's Sudarshana Kriya, it is more biological, more breath oriented. Number 3, I have been practicing the japa meditation, Om Namah Shivaya. All the 3, do the 3 streams of meditation have the same final results for your testing?
Yeah, see, what is the purpose of meditation? We may use different techniques of meditation. For example, like we are studying Vipassana, Raja Yoga meditation. See, Raja Yoga meditation is mainly of a contemplative technique, whereas Vipassana is of mindfulness meditation. So there are various techniques. These are all tools for you to, get something. Like, say, for example, understanding or achieving the mind-brain harmony, and integrating the brain functions, and also maybe even higher states of consciousness through meditative practices. So, but there will be differences. See, for example, we cannot expect the same kind of result from each meditative technique. Ultimately, you are achieving. See, you may be achieving that through different ways, So ultimately, even, for example, positive emotions or ecstatic emotions, you may be achieving it. Even, say, for example, even without having any change or measurable change in the brain activity. So that shows that there is, like a dominance of mind over matter. So various ways.
Mind over matter, and all roads lead to the mountain.
Yes.
And the final question to Ma'am Jamna.
To add one more point.
Yes.
About mental faculties, they losing their capability in mental or physical malady, that has been mentioned in Indian aesthetics. A 10th century Sanskrit aesthetician and poet, playwright, polyglot, polymath Rajashekhara in his Kavya Mimamsa saying, 8 are the mothers of poetry or creativity. Ashtau mataraha kavitvasya. Their dakshyam, smritihi, darjyam, like that, he says, physical and mental capabilities, they are very important. They are so obvious, I think, well understood and
directly impinging on the consciousness. Directly. The final question to Dr. Jamna, this is very sensitive and quite contemporaneous. We all should probably know this and probably try and answer this. My hypothesis is this. More direct art impinges on the subject more than imaginative arts do. I shall give 2 examples. The 2 examples are of creative geniuses, but only the flawed geniuses. One is Reichsführer Adolf Hitler. I have a set of paintings of Adolf Hitler's, of course copies, not the originals. He has drawn a castle on a mount from where he belongs, actually an Austrian village, near an Austrian village. And the castle is slightly inclined towards the left. And another, an ancient building's painting he had done in his younger days, and it has slightly tilted to the right. Thereby, almost all understood that this genius, though a criminal, is fraud basically. This is one thing. I have not completed. The second one is a very contemporaneous one.
Sir, we have other people waiting here. Please. Please.
Okay.
Yeah, because we have only 5 minutes left and 2 people are waiting here. So
Yeah, we can discuss this.
Thank you very much.
Hi, I am Apruv. My question is to Professor Kruger. Specifically about, you talked about administering oxytocin. Oxytocin. Are you forcing some ethical issues, or is there framework already defined for the use of oxytocin?
Sorry, acoustically, can you repeat that?
Yeah.
Sorry. Yeah.
Do you foresee this some ethical issues in use of oxytocin in society?
Ethical issues.
Or is there any already framework defined on that use, doses for
If I'm
Are there
using,
any ethical issues using oxytocin?
why I'm using oxytocin? No.
Ethical issues.
I'm asking, this particularly, do you foresee?
Any experiment? Experiment using oxytocin.
What are the doses?
And whether there is any
Any ethical issues to use it or
I mean, there's standards using how many of this in each of the nose, the nasal, just like in the community, like there's animal studies. Basically, somehow the stuff has to get to the brain, right? So you're using, they measured in animal studies, and they would say, this is I don't know, in our case, 40 universal units, this is the one, and then you have to do half on this node, that one. So this is this is what every study does, the same. So it's your argument that you give more, that you be more pro-social then, or?
Yeah. So,
I mean,
particularly for cows, it is now for the increasing milk, or something like that. If it, on social issues, it will have some other implications.
do they have any other social implications?
What oxytocin does? Yeah. I mean, it's not, it's basically, the trend is like 10 years ago, you would get a nice science paper or a nature paper, it would say oxytocin increases your belief in God or something like that, right? Or something like that. But the basic, remember the slide I showed, basically oxytocin is working on a very low level. So it reduces anxiety, this is stress, anxiety, and that has also shown in animal studies, etc. It's more salient, so you're more focusing attention stuff. So it's on a lower level, and that influences in a higher cognitive level. So it has nothing to do with belief in God. Basically, have you heard about the read me in the eye task? So you have to see the eyes, and you get emotion, and you have to, right? If you give you oxytocin for the tough ones, you get better. The idea is not that you are now better mentalizing it, but you are more focusing the salience of one, you're focusing more on that. And autistic kids, for example, which are not looking at the eyes, they are more focused on the eyes. And that's, so basically, the trend is, and there's a lot of critique in the field, it's like, it's a basic low-level one, which then influence higher cognitive, so no science paper anymore about oxytocin does this or this or that.
When is that more?
So my question is more related to arts and creativity. According to our Indian culture or any other culture, do our ancestor has classified the arts based on the type of arts, like dancing and playing the instruments require more motor actions, while poetry and writer does not require any motor actions. This is thinking out of the box. And maybe based on this, do you have any classification related to science, also related to brain? Any classification is there on the arts? I heard that there are 64 arts. On what basis these 64 arts are divided like this?
Thank you. It's a very good question. But in our tradition, we don't have any such classification connect with brain and all. Because in our tradition, that has been what I told. It is more clinical and less of laboratory. But 64 arts, that mentioning is there in Vatsyayana's Kama Sutra, and there are other systems also. For example, in the Buddhist work, Lalita Vistara, they have 83, and also in the Jain tradition of Prabandha Chintamani, 72. Like that, there are various types of arts, not just 64. But later scholars, they have, based on the nature of art, they have divided utilitarian art, pure art, fine arts, applied arts, something like that. But in the Natya Shastra, supposed to be the oldest work connected with the art, practice and analysis in Indian context, there we have, though special categories are not made, they have given details of training. By that itself we will be knowing. A dancer is supposed to get trained in this way, while a singer in some other fashion, while the poet in some other. So specializations have been made. By that we can as well infer. For example, in Natya Shastra, he is expected, a dancer is expected to know so many things because it is a composite art. But not all these are needed for a poet. But poet should essentially have, it's a desirable quality, not an essential quality. A poet like Kalidasa, by internal evidences we can clearly know that he had good understanding of music, both in veena and on percussion instrument like mridangam, and also he was adept in theatrical arts, and he had good knowledge of painting. That way we can infer, but no deliberate mentioning. And then how the body acts, all these things are not given in detail, but we can know they had an eye of all these things.
Okay, then let's conclude the session. First of all, I thank all the speakers, Shadavdani R. Ganesh, Bindu Kutti, Jamuna Rajan, and Frank Kruger for giving us a very beautiful lectures, and the audience who has asked stimulating questions. The concluding remark could be, we started with meditation and yoga, and just like if I can borrow the title of a paper from Professor Sangeeta Menon, where the mind challenges the brain to converge. Then we moved to Shadavdani R. Ganesh's talk, where he described how emotions and experiences are converted into expression, and Professor Jamuna gave the neural basis of that, and Professor Kruger suggested if that creativity is going against the social rules, how it can invite third-party punishment, and what is the neural basis of that. So all these results shows that the convergent point, again I am taking words from Shadavdani R. Ganesh, that everything well matches in art. So the future of consciousness studies, cognition studies, everything will be analyzing arts, humanities and social science. Thank you very much.
I have to personally thank Dr. Sangeeta for the kind invitation, and also Niyaz and all the participants and the panelists. It's a really enriching and encouraging session. Thank you.